Hi and welcome to this video and to my channel. Many women that I work with that have pelvic floor dysfunction also have to some degree diastasis recti, which is the separation that happens in the abdominal muscles when you are pregnant. And it's completely natural and it should happen. That separation when your belly is growing and then the abs are separating. Then once we have given birth, of course, we want the abdominal wall to close back again. And this has to do a lot with the connective tissue known as fascia to do. So we really need to heal the fascia. And we have great programs for that. In this video, I just wanted to give you the chance to see for yourself if you actually have diastasis recti. Not all women that has it knows about it. Some women do, and some might think that, something is off here. But this is a really good way to check if you have diastasis recti or not. And if you do have it, if you do what this amazing practitioner, Caroline, she's a physiotherapist, and she has healed a very severe diastasis recti herself. If you follow her instructions and you realize that you have a diastasis recti, I really recommend you to work on that. And of course, we can heal diastasis recti naturally. No need for surgery. So yeah, let's take a look at this video and good luck finding out if you have diastasis recti.
We are measuring ourselves for a diastasis. We're going to be looking in 3 different spots. So first we're going to measure right below the sternum. Okay, so kind of right in between the belly button and the sternum. Then we're going to also measure at the belly button itself, and then midway between the belly button and the lower belly. So when we do this, we're going to be looking for 2 different things. One is going to be the actual width of the separation. When I measure a client, I usually use a tape measure that has centimeters so that it standardizes the measurement. But a lot of times you'll hear people talk about a diastasis measurement in fingers. And so what that means is just how many fingers you can fit in between the separated abdominal muscles there. And so that's fine for you to use at home because you're going to be the only one measuring yourself. So using your fingers is fine. So you're just going to want to make a note of how many fingers you can fit in between the abdominal muscles there. The second thing that you want to be looking for is the condition of the connective tissue. And so that is how deep you feel like you can sink your fingers into your stomach. As the connective tissue stretches, it gets thinner, and so it's going to offer less resistance to pressure. So ideally, healthy connective tissue should feel similar to the skin in between the thumb and the forefinger here. Okay, you can feel how you can press in a little bit, but it's kind of firm. And so that's ideally how it should feel down the midline of the body. Usually with a separation, you feel like you can sink your fingers in a little bit into your stomach. So for this measurement, again, I normally would measure it in centimeters, but if you just want to use your finger, you can just note, whether it goes, let's say, up to your fingernail or up to your first knuckle, or in more severe cases, maybe up towards the second knuckle there. And so you're just going to want to make a note of that again on our little sheet so that as the weeks progress, we can make sure that all of those numbers are improving. So to do a self-check, you're going to want to lie on your back and just have your feet flat on the mat and the knees bent. Okay, so when you're doing a self-check, you're going to want to just be flat on your back with your knees bent and your feet flat on the mat. And you're going to use your fingers pointing down towards your pelvis because we want to be measuring the width of the separation. So you can bring your shirt up a little bit so that you can get a good, accurate feeling here. So I would say let's start here at the top. Okay, so you're going to have your fingers pointing down towards your pelvis. Okay, and you're just going to bring the head up a little bit off the mat and see if you can feel the edges of the recti muscles contract. And then as you lower the head down, you should feel those muscles relax out to the side a little bit. Now, this is going to take some practice. I feel a lot of bellies every day, so for me, I can feel this after, having someone lift their heads up, 2 or 3 times. But for you, this might take some practice. So just kind of play around with it and get a feel as you come up and down of whether or not you can feel the muscles coming together. So as you bring your head up, that causes the abdominal muscles to contract. So as you lower the head down, they're going to relax up to the side. So that's really the measurement that we want to be getting, is how many fingers we can fit in as the muscles relax out to the side. So once you feel like you have a pretty good idea here at the top, okay, I would also just make a note then of how deep you feel like you can push your fingers into your stomach. You can see here, it's pretty springy. I'm not really getting a lot of, I'm not able to push deep into my stomach here. So this is a sign of good, healthy connective tissue. Okay, so once you have that measurement, you can write it down on your sheet, and then you're going to move down towards your belly button. So for the belly button, it's going to be the same thing, fingers pointing down towards the pelvis. You're going to bring that head up and down and up and down. So you might be able to fit 2 fingers, you might be able to fit 3 fingers. You might need 2 hands to measure this, okay? In some severe cases, you might need 2 hands, for that number of fingers to come up. So play around with it again. Try and get as accurate a picture as you can. And once you feel like you have that, then again, do your connective tissue test and see how deep you can push into your stomach. Once you have that, you're going to move down to the lower belly. Okay, so again, that's going to be midway between the pelvis and the belly button, and it'll be the same thing, coming up and down, and you might have to feel around a little bit until you can find those recti muscles. And once you have that measurement, you get your connective tissue, and that should be enough information for you. Ideally, we're going to be wanting to get the width down to 1 finger, okay, or less. So you should ideally be able to fit just 1 finger or maybe even less in between the abdominal muscles. And for the connective tissue, you're going to want to, be barely able to push down. So maybe just, midway up that fingernail there. That would be the goal.